we need to take a moment to talk about how Taiwan managed to stomp down corona because it is absolutely unreal. Of the more than 100 countries and territories affected, Taiwan boasts the lowest incident rate per capita at just 1 in every 500,000 people. As of March 19th, the total number of confirmed cases in Taiwan shyly rose to 108, out of their population of 23 million. That's astonishing, considering their proximity to China and the fact that the outbreak found its footing at the same time many were traveling back and forth to celebrate the Lunar New Year. That means about 2,000 Chinese tourists were visiting Taiwan a day. So how is it that the island is handling this whole dilemma far better than the US is or ever could? Some trace it back to the 2003 lessons learned from responding to the SARS outbreak. Because temperature monitors were already set up after that situation, once Taiwan controlled its borders, they used those monitors to detect anyone with a fever, which is a symptom of corona. If you were coming from a heavily affected area, you were put under quarantine arrest, a mandatory 14-day quarantine, and tracked using your phone's location sharing. And if you dissented from that, you'd be fined. But we also need to acknowledge that shared language allowed Taiwan to know early that a severe pneumonia was spreading in Wuhan, and helped its Center for Disease Control to take proactive measures, which included immediate inspections of passengers arriving from flights on Wuhan, the same day that China notified the World Health Organization about its several cases of an unknown pneumonia. After sending a team of experts to China on January 12th, Taiwan began requiring hospitals to test for and report cases to help the government identify the infected, trace their connections, and isolate everyone to prevent the spread into the community. Before Taiwan even had its first case confirmed, their CDC set up the Central Epidemic Command Center, which quickly rolled out a series of epidemic control measures. A lot of epidemic control measures. Over the span of 5 weeks, they implemented a list of at least 124 action items to protect public health. And then, public health announcements with the information about how the virus spreads and how to stay healthy, your typical epidemic prevention protocol. Taiwan's universal health care also allows residents free testing and paid 14-day isolation, meals, lodging, and medical care. But all else, what helped make their response efforts so effective was the psyche of the people that's rooted in community support. Nearly every office building, school, community sports center, you name it, were using temperature radars to detect anyone with a fever and prevent them from entering. The world needs to take notes.